Today is October 18th, 2012. This is Reggie Licari. Hi, Reggie.
Hi.
Reggie came in June for chiropractic care for neck and back complaints, and he had other health concerns, one particularly being type 2 diabetes, which Reggie was initially diagnosed 3 years ago, which was 2009. Reggie, you want to just tell us your story?
Yes, in 2009 I was diagnosed with type 2 diabetes, and at that point I had gone through a diabetic class and had seen a dietitian and started to talk to me about some do's and don'ts about what I can eat, what I cannot eat. And so I started pretty well. I was checking my blood 3 times a day. My numbers would vary anywhere. They were always over 100, sometimes well over 150 into the 200s. Not long after, about a year after I was diagnosed, I unfortunately lost my job with a company I had been with for over 20 years. I stopped checking my blood and really just did not take very good care of myself, and I let myself go, which included weight gain. So when I came to see Dr. Siebele and moved here to Red Wing, my weight was probably between 255 to 260 pounds. So initially came to see Dr. Siebele. I was suffering from very severe neck pain, and I had some back pain, and really I was not in a very good healthy condition. And so I started to talk to Dr. Siebele about not only adjusting my my neck and back, and we started talking about overall nutrition and proper living habits, and started talking about, which was surprising to me because I was told that once you were a diabetic, or you're always a diabetic no matter what. And when Dr. Siebele told me that, you know what, you can reverse your diabetic condition, it kind of piqued my interest and said, you know, maybe that's something I need to look into. So I began treatments with Dr. Siebele, and about a month later we decided to do a blood test. I had a comprehensive blood test where it showed that my A1C, or the blood sugar in my blood, was a very high and very critical 9.8. And at that point I was probably around 255 pounds. After that I consulted with Dr. Siebele, went on some nutritional supplements, a special meal plan, and then he gave me some specifics of what would be good for me to eat and what wouldn't be. So I started on this diet, started with a 7-day strictly green vegetable. I don't mind vegetables, but I don't know that I can eat green vegetables for a while, and to be honest with you. I know all of you out there that might think, oh, it's not the easiest. I actually had to go to a movie after 7 days just to chew popcorn. But
Reggie, how hard was it to do the 7-day intensive detox, which was one organic green vegetable per day for 7 days, and then your medical food powder for your diabetes? How difficult was that?
It wasn't that difficult at first. It just by about the 7th day you got tired of green vegetables. But really it wasn't, because as you explained it to me, it was a detoxification of my body. So to start the process you had to get your body on the right track, and I had committed myself after talking to you that that's what I wanted to do. But other than just getting tired of chewing green vegetables, it was not that difficult because I made the choice to.
So it's been 11 weeks. What's happened?
Well, in 11 weeks, working with Dr. Siebele, getting a little bit more exercise, taking my supplements, my medical food, and following his plan, I down to 222 pounds.
Starting from 255?
Yes. And my A1C has dropped from 9.8 to 6.0.
Can we just show that, Reggie, on the paperwork?
Sure.
So here's Reggie's paperwork. As you can see, Reggie Licari, and I'm going to go over to his initial. Here was his initials, Reggie Licari. You can see his name there. His glucose serum fasting was 148, and his hemoglobin A1C was 9.8 at high, and you can see glycemic control for adults with diabetes is supposed to be less than 7.0, and Reggie was far beyond that. And the date of this testing was July 21st, July 29th, 2012, right there. And now we're coming here to October 13th, 2012. And you can see his A1C had gone from 9.8 down to 6.0. Still high, but dramatically better. His serum triglycerides had dropped noticeably, and his fasting glucose went from 148 down to 103. Reggie, how do you feel now compared to where you were when you started? And how did this information, the test results, how did it make you feel?
From where I was when I started with Dr. Seeley to where I am now was really no comparison. I feel so much better than I did, better about myself, and just health-wise I feel better. I'm not as lethargic or tired. I have more energy. As far as the test results, I'll be honest, I'm somewhat speechless. I was hoping that even if I went from 9.8 to say 7.8, which would have been higher, I would have been happy with that, because that would have been a pretty good drop. I was not expecting to go to 6.0, but it just proved that following a proper diet, proper nutritional supplements, and just a more healthy way of living, that you can and will improve your health. And I'll be honest, I'm stunned. I've reversed diabetes. I almost don't know what to say, to be very honest with you.
Reggie, all I can tell you is I'm sincerely want to congratulate you. I'm proud of you. I have been in practice for almost 30 years, and as I told you before in the consult, I've not seen anyone reverse your diabetic condition, type 2 diabetic condition, with an A1C of 9.8 in 11 weeks like you have. So I'm really proud of the job that you've done. Great job.
Thank you.
Reggie, do you have any advice for future patients?
I would tell you this: I'm like everybody else. I grew up with a mother who loved to cook, and I loved to eat, just like my dad. We all get in states sometimes in our life where maybe we don't take the best care of ourselves, and life can get fast and it can get busy, and sometimes we forget to take care of ourselves. But what I can tell you, having been through this, if you commit yourself to it, it's not as difficult as you might think. But you can do it. And I'm proof that I'm as regular as anybody else, and that I am doing it. And do I have my little snitches every now and then? I do. But I also remember that after I have my little treats, I need to go back to the program that I've been on with help from Dr. Seeley. If you're willing to commit to it, there is no reason that any one of you, we're all in the same boat, you can and will see a difference in your health.
Cool. Reggie, do I have your permission to share this with doctors, students, and patients anywhere?
Absolutely.
Thank you so much.
You're welcome.